to go ahead and get started. So again, I want to welcome everybody. This is day 2. I thank those of you that have come out a second time around that were here for our kickoff yesterday. And now we are welcoming for day 2. Our topic today is the Black Reproductive Healthline. That's just a playoff hotline. We wanted to make sure that we had 2 influential people here with you today that can talk to the different things that are plaguing our Black community, specifically our women and our reproductive health. I, as somebody that has suffered with fibroids, cysts, blocked tubes, polyps, you name it, I dealt with it. So we have here with us Dr. Stacey Edwards Dunn from Fertility for Colored Girls. I'm going to bring her up first. Dr. Dunn, could you please introduce yourself?
Hi, excuse me. Thank you so much, Deanna Murray and Bearing Fruit. It's such an honor to be a part. As you stated, I'm Dr. Stacey Edwards Dunn. I'm the founder and president of the National Organization for African American Women and Couples and other women of color who struggle with infertility, Fertility for Colored Girls. I also serve as the church administrator and executive minister of community engagement for Trinity United Church of Christ in Chicago as well, and on the staff at McCormick Theological Seminary as adjunct professor. So that's a little bit about my background. I spend my labor of love is Fertility for Colored Girls and serving women and couples, particularly women and couples who have been kissed by nature's son, who struggle with what I think is also a pandemic and an epidemic called this giant infertility.
Sorry, Deanna, you're muted.
I just do this every single day, like every day. So I was just saying, as you mentioned, like you work a lot with people that are kissed by the sun. I like the way you worded it. What are some of the things that you can say to those that are on the call that are currently dealing with fibroids?
Well, with fibroids in particular, well, as you know, Black women and couples and particularly Black women struggle with infertility at 2 times the rate than any other culture. And particularly when it comes to fibroids, Black women are struggling with fibroids at 6 and 7 times higher rates than any other ethnicities. And we're seeing young women, they're also being diagnosed at younger ages than any other culture. Many are suggesting that's for a number of reasons, from the environment that we're living in to some of it is genetic, some of it is due to the types of foods that we're eating. Some of it, some research has shown, could be due to the type of product or things that we're putting into our bodies as well. So many reasons why African American women are experiencing fibroids. And one thing that we're finding, particularly with these fibroids, is that when we go to doctors, who oftentimes Black women and couples, you know, a lot of us have a lot of mistrust with many medical doctors. And a lot of that is historical, based upon some of the things that we've experienced, particularly when we've encountered physicians. But, you know, one, being able to find doctors that truly care for our total well-being, and that is really willing to talk with us about this condition of existence called fibroids that we're experiencing, and coming up with protocols or solutions that are you know, personal for us. One of the things we hear many African American, or I've heard many African American women say, and even many of the doctors that have spoken for Fertility for Colored Girls, is that when we go to see a doctor, sometimes because out of fear and just because they don't, some doctors don't really necessarily want to deal with the fibroids, Many of them might suggest automatically hysterectomy rather than any of the other options that might be available to Black women, such as myomectomies, the changing of diets to, if we're eating a lot of chicken per se, to decrease the amount of estrogen and those things that we're putting in our bodies, and move to more plant-based diets to help to decrease the size of those particular fibroids in our bodies. And so again, those are some of the things that we're hearing, particularly as it pertains to fibroids. We know that Black women are experiencing them at insurmountable rates in comparison to other cultures. And so again, making sure that we see doctors that who really care and are going to treat us rightly when we have to go see them to find out how we can reconcile these fibroids that are taking place in our bodies.
Okay, let me make sure I'm not muted. Okay. Thank you so much. I appreciate that. Speaking of doctors, and which is why it's so important for me to have this platform, not only because I know so many women that suffer with fibroids, and we know that 80 to 90% of women will develop fibroids by the time they're 50, but as someone that went through a series of doctors and even researching different doctors, and found a Black doctor that appeared to be well-versed in endometriosis and fibroids and all the things that I thought I was dealing with. And I say thought because I went undiagnosed. And so many women go undiagnosed, that when she didn't listen to me, she did not read my charts. She did not follow up. I had things that were showing up that I needed surgery for, that I had to realize that on my own, or when I went on to get a second opinion, which is why I'm always telling people to fight for themselves and advocate for yourself. It was very important as we had this conversation. It was like laid on my heart, and I know it was nothing but God that we were able to add another person to this conversation who is also a doctor that has gone through these same things and is also an advocate. So I also want to welcome Dr., and I don't know if I'm gonna say it right, is it Soyini?
Yes.
All right, Dr. Soyini Hawkins. She's a board certified, trained, minimally invasive gynecologic surgeon. She is a provider at Fibroid and Pelvic Wellness Center of Georgia in Alpharetta, Georgia. Okay. Dr. Hawkins provides specialized surgical management of abnormal uterine bleeding, pelvic pain, and most benign gynecologic conditions. She is also active in her church and community as a member of several societies and a participator in numerous outreach endeavors. She is a beloved member of Delta Sigma Theta sorority.
Hey, Soror.
Hey, Soror.
As a fibroid and endometriosis conqueror herself, she is passionate about education, advocating, and treating fibroid and endometriosis sufferers. She feels her wellness journey is a true testament to life beyond these ailments and encourages all women to live their best healthy life. I also want to welcome Dr. Hawkins to the conversation. Welcome.
Thank you. Thank you so much for having me. I'm enjoying this conversation. I done woo-sawed a couple times listening to you ladies and exhaled a couple times already. So I'm looking forward to it.
Is there anything that I missed in your bio that you would like to tell the people about yourself?
No, I think that pretty much sums it up. What I do is really out of a testimonial, out of my own personal journey with fibroids and endometriosis and just being a woman. And I dedicated my career past training specifically to it, meaning that I went back and did a fellowship for 2 years to learn how to do minimally invasive surgeries, robotics, laparoscopic, how to not always tell a woman they have to be cut open, because that's what I got. That's what I got from my fibroids, and it did me well. I have 2 beautiful baby boys from it, which I couldn't do before it. But it was important to me as an African-American woman to be able to and put myself in a position to empower others to have options and not be told they have to have a hysterectomy.
I love that when you said options. And that's one of the big things I kind of want to drive this week with everything we have lined up for the week for Infertility Empowerment Week, as I like to call it, not just bringing awareness, but bringing empowerment not just to the people that are affected, but the people that are around us, because they're also affected, or they should be affected, because it affects us all, and we should be supporting each other. So, right, sometimes doctors will make us feel like this is the only way, or this is the only option. So I liked that you also knew about other ways to navigate these fibroids in particular. What would you say about the procedure? And I don't know all the technical terms for it. Egypt, we were looking at it yesterday.
Yeah.
I don't even want to say it wrong, but it's when it's burned off so that the fibroid dies and it shrinks.
Ooh. Acessa, is that the one, radio frequency ablation?
Embolism or something like that. It was like,
so there's two that I would say are the two top minimally invasive options for fibroids. There's uterine artery embolization, or uterine fibroid embolization, and there's also now radio frequency ablation, which is heating up the fibroid to where the fibroid will naturally shrink and your body will eliminate it, essentially. Performed two totally different ways. The uterine artery embolization is done by interventional radiologists, not gynecologists like myself or surgeons. And what they do is they block the vessels around the blood supply that goes to the uterus and then to the fibroids. And again, the fibroid is able to naturally shrink over time. So two really, really great minimally invasive options. You need to be a good candidate for one or the other, but they're wonderful alternatives to hysterectomy, and in line with preserving fertility for many women.
Thank you so much. If those of you that are on this Healthline, one, if you could put in the chat where you're from, so I know what cities we have on the line, and also what different types of health concerns you may have, so that we can make sure that we cover it in the discussion. Are those procedures widely known? Someone is asking.
Yes, so the uterine artery embolization has been around for a very long time. They're still doing a lot of research when it comes to its how well it works with fertility. The Acessa procedure was FDA approved in 2012, and I would say it's the newest technology to treat fibroids in a very minimally invasive way. And I offer it in my practice, and I'm so excited to be able to do that because, again, it's answering a lot of the questions that a lot of women have fear about when it comes to their fibroids. That one, will either keep them from going to the doctor, two, will keep them from realizing they have options to not suffer from month to month or from week to week even, and it gives them this without putting their life on complete pause. Like, they're able to, have the procedure done, go home the same day, be back to work in a week, and move on with their life and not have to suffer from their fibroids indefinitely. So they're newer, but they've been around for quite some time. It's just not widespread because not all doctors are able to do it or have been trained to do it.
Okay, we have another question that is, are you still able to become pregnant after these procedures?
So the research is ongoing for that, for both uterine artery embolization and for Acessa radiofrequency ablation. And there's actually another company that does it hysteroscopically as well, called Sonata. All of these companies have had pregnancies after the procedure. As far as the guidance towards that, it's not concrete or it's not consistent across the board because more research needs to be done to have the numbers. You have to have 600 pregnancies after one particular procedure to be able to go to the FDA to get that stamp of approval, right? And that 600 has to be with good outcomes and proven and whatnot. So it's uterine artery embolization. I have throw caution sometimes that patients need to know and speak with their provider or the specialist that they're getting to do that procedure and ask them, what about fertility after this for my particular case, for what my fibroids are doing. It's important to individualize it every single time for every single patient. And Acessa is the same thing. I talk very frankly to my patients about fertility and their fertility desires when I offer every option that's out there, including Acessa. But like I said, there have been hundreds of pregnancies. I can speak for Acessa because that's the one I do, that have come after Acessa, and successful pregnancies at that, not with complications or problems. So we're getting the number, able to put the stamp of approval on, but from a physician standpoint, yes.
Thank you. Currently, we have like a number of people from all different areas. What advice do you, like right now, I'm seeing we have Phillies in the house, California. I know we have some fellow Fertility for Color Girls gladiators in here. So that's awesome to see. California, did I mention that? Bay Area, California? Okay, awesome. So what, in Newark, New Jersey, Michigan, awesome in here. Okay. What do you suggest for the people that are on this line? Like, what is the best way to find a doctor that does these procedures that, like you said, are not currently, you know, have the seal of approval, but they're being done and they're minimally invasive? Is that being done in our cities, or how do we find that out?
Yeah, research, research, research. Google, Google, Google. Do not be afraid of it. So, like, for example, I'm in Georgia. I'm the only doctor in all of Georgia that does this procedure. And up until last year, I was the only one on the East Coast that was doing it. Now we have a couple of doctors in North Carolina, but I have patients that come in from Florida and Tennessee and Alabama and all of the surrounding areas. I've had patients come from Canada. To get these procedures. So the doctors are out there. They might not be in your immediate city or vicinity, but if that's the procedure that works best for you and makes sense for you and you're a good candidate for it, I have to stress that, then you can call, you know, the nearest doctor or a doctor in a city where you have friends and family, and do consultations. I do virtual consultations, like we're doing telehealth big time now. I've been doing telehealth because I want these options to be available for every patient, no matter where she is. And you can find the doctor that's closest to you and your insurance will cover it. So when I have patients come from out of state, they're not, you know, held up, worried about the financial aspect of it as well. Their insurances will cover it if it's you know, under their policy. So do your research, find your doctor. You don't have to be limited to what is in your area.
And I would also like to suggest that, you know, now you have Dr. Hawkins, who now becomes a resource. I think organizations like Fertility for Color Girls, the support groups, the support groups, within those support groups, asking those questions of the women, if they've ever went through those procedures, and then finding out who their doctors are. In addition to that, organization like Fertility for Color Girls, we are able to connect you with those doctors because of our relationships, not just with both African American doctors, but other doctors who we have vetted, who we know that are going to care for you rightly. And if we don't know one, we know how to get to a doctor such as a Dr. Hawkins or Dr. Jessica from Dallas, Texas, to say, hey, can you let us know who is in this state or who we can get a patient to, that can care for them. And so we also, in addition to Google, really making sure that we utilize the resources that we have at our fingertips and the connections that we have within the community to get you connected to a doctor that will advocate for you and that's going to care for you rightly and that's going to look at your situation, personally and individually.
Thank you so much for that. I agree. And that's, what we are also trying to do here, with bearing fruit. Obviously in the beginning stages is our second time around, but right now, like I always recommend my doctor. He also is an endocrinologist, but he's also a white man. He did not look what I expected him to look, but he was awesome. He helped me put a baby in my arms, him along with obviously God's help. I was able to birth a child. But it sometimes doesn't look the way and package the way you would think it would. Here I had a Black doctor that I sought out, researched, and she ignored me, so it broke my heart because I realized that I was just a number to her. But just saying that, that's not enough. You have to go beyond that, and you still have to, before you can allow someone to advocate for you, or as we were talking about last night, we want to find people that will join our team and advocate for us, but we first have to advocate for ourselves. And that includes doing your due diligence and researching asking for your charts, getting a second opinion, seeing what your options are, which is why I'm so happy to just connect with a number of people that are fighting this or in a different community, but also all over, not just in this area, because sometimes we can only see what's in our area and not realize that there are other options out there. And I don't know if people that are on this line are anything like me, but when I really came down to, I am willing to do whatever it takes, not just to have a child, but I first had to have a better quality of life. So I really want to start there. Because I was in a lot of pain. And I know for a lot of you, it's not just fibroids. So I do want to also talk about some other things, but those of you that are dealing with PCOS, endometriosis, blocked tubes, cysts, rupturing cysts, like I want to make sure that first deal with self. Like, cause sometimes we ignore all those things. Like I ignored all those things. It's painful, but I wanted a child so bad that I just got used to 90% living of pain. So again, it took my doctor, who, for those of you that are local, his name is Dr. Larry Barmatt. He is an awesome doctor up here, right outside the city of Philadelphia, that also does, IVF. He did all my surgeries. I'm not sure if he does the procedure that you're talking about, because I do want to reach out to him and find out. But the first thing he said to me when I walked in the room was, well, after he said you need surgery, he looked at my previous charts from what the previous doctor ordered but never responded to. Before he even did his own exam, he was like, looking at your results, I don't know how you're walking around like this. Like you need surgery. Not only do you need surgery, but we first want to address you having a better quality of life. Then we can have the discussion of the child. So for those of you that are on the call that are dealing with first health concerns, I want you to focus on dealing with that first, because we do deserve to live a better quality of life. We do not deserve to live in pain, and that should not be accepted. So this question is for either one of you. Like, what do you have to say to the person that is on the line that is dealing with other like health concerns as a Black woman? What advice do you have for her to first handle herself?
So I can get fully technical and into medical jargon and all that stuff, but the reason that I put in my bio that my ultimate goal in all of this is to help women understand how to live their best healthy life, meaning their specific best healthy life, is because of everything that you just said and noted. A lot of times patients are making decisions with me about surgery based on very specific things, like I want to get pregnant, or I want to not bleed heavy every month. And I, like your reproductive specialist, kind of always pull them back to, okay, but what about your day-to-day? What about your week-to-week and month-to-month? Are you suffering? Do we want to do this because you simply do not want to, and you don't have to suffer anymore? Like, how do we get back to living our best healthy life? Dr. Dunn talked about all of the things that we could do to just honestly move away from processed foods and things that are not good for our nutrition period anyway. Why aren't we exercising? Are we exercising just for our fibroids? Or are we exercising because it's good for our cardiovascular health and it feels good and it gives us, a glow, and we feel sexier and we feel more like a woman? Like, why are we not, why do we get specific into our goals of what we're doing, especially when it comes to reproduction? We want to and have to work on being just our overall best healthy self. I did a talk last week with a fertility specialist, and one of the key points I pulled away and made sure I reiterated for our listeners and viewers were that when you're seeking fertility for any reason, one, remove the barriers, remove any of the medications or anything that you're doing that might not help you get pregnant. And number two, remove your own personal barriers. Make yourself your best healthy self, period, point blank, just to live a good and fulfilling and, a God-pleasing life. So I'm with you 110%. Forget all the medical jargon. You gotta make sure you're doing it all for you and to feel well.
And I would add to that, that these conditions that we are dealing with, they are not who we are. So infertility is not who we are. PCOS is not who we are. And so, when we can understand that it is a condition, it is a diagnosis that we're dealing with, but it's not who we are. And so when we can understand that that's not who we are, but who we are whole people, and that we are fertile at our core. So when we can understand that fertility is a condition of being, it's who we are, that at the core of who we are, when we become, as you stated, Dr. Hawkins, when we begin to live our best selves, and we understand that when God created us to be life-giving persons, just every day. So everywhere we walk, we should be giving life. And so when we understand that at the core of who we are, that we are life-giving people, that and then when we can embrace that about who we are and understand that we deserve to have a healthy life, we deserve to be well, we deserve to have abundant life, and like you said, not necessarily to tolerate this idea of suffering. I think as Black women, oftentimes we've learned how to tolerate, you know what I mean? We learned how to just constantly live in a place of survival. And I think that we have to move beyond that, that idea of just, constantly suffering in order to take care of somebody else. But we have to get to the point that we have to realize that we deserve healthy living. We deserve to be happy. We deserve to give life. But first to give life to ourselves. And so I think that those things become important, because when we can get to that place and understand that when God made us as good beings, and live out of that, we then will be and love ourselves. Then we will begin to advocate for ourselves and not accept anything less than when we walk into doctor's office. And we'll go into doctor's office and say, I'm not going to leave this place, and I'm not, until I get some answers, or I'm going to leave this, I'm going to walk away and go somewhere else, because I also realize that I deserve better. I deserve to be treated better. I deserve for you to see me, but we got to see ourselves first if we want somebody else to see us.
I like that.
And recognize, like you said, that, we would love every African-American doctor to be able to advocate for ourselves. But the reality is that everybody our color isn't our kind either, right? And so we have to be willing to and be open to, really being prayerful, or even in our own meditation time, to being directed to the doctor that is right for us. Because there is one that's right for each one of us. And it doesn't have to do with anything about ethnicity. It is one that has been God ordained for each one of us to help us to walk into our purpose and embrace the blessing that God has for each one of us.
I always say compassion and competence has no hue.
That's right. Yeah.
I like that. And that's why, like, I always like to mention that, because I know for some people, sometimes we have our preference. And in general, I tend to favor the female doctor. So it was very ironic. Well, God tends to be that way. That the very person that listened to me, that I felt the most comfortable with, that actually took action, and was the first person to actually have care and concern for my pain first. As a Black woman, like as you guys know, we're always taught to cope, I mentioned on yesterday's call that I had suffered with pain with my period from day one. When I was 11, when I got my first period, was excruciating for me, and it continued to be that way into my 30s. And I was never really heard. It was almost like, this is normal. This may be the hand that you're dealt, so you deal with it. And I tend to be that way, and with a lot of things in my life, but I've learned not to be that way with my health. It's not okay to just tell our young girls that you may have endometriosis, or you may, so just deal with it, or just take, birth control. I just don't think that that's enough. Like, we need to educate people, which is why I was really, really encouraging people of all ages to come on here, because sometimes people think, oh, I'm not trying to have a baby, but no, this discussion is for anybody that has a period, or knows somebody that has a period, or is dealing with any type of reproductive health that is of concern, and that has no age. So I thank you for saying that, because I literally broke down in the doctor's office that day, the first time. And it wasn't, I cried, not just because he said I needed surgery, but I felt like he heard me and he listened to me. And because I was ready. That day I had researched, I pulled up all my charts, I was looking up terms, and I realized that I did have a condition that my fallopian tube was blocked and blowing up like a balloon. Dr. Hawkins, I might be saying it wrong. Is it a hydrosalpinx when your tube is blowing up with fluid?
That's
so
exactly
that's
right.
what did you say?
That's exactly right, hydrosalpinx.
Yep. So yeah, I had that, and the doctor never called me back after my exam, and I had that for a whole year afterwards. And I then had a cyst that ruptured at home, and I never went to the hospital. So when I walked into that office and the doctor said that, and I knew that there are other women, and you may be on this line, that have felt that way, have felt unheard, or felt like you only had one option, or doctors that kind of weren't encouraging of you seeking a second opinion. Like, I want to encourage you to do that and to do your due diligence. I know that there's some people on the line that are asking for referrals and resources. I know of a couple doctors that are here locally, and I know just from listening to both you, Dr. Hawkins, and Dr. Dunn, I know you also know of some other doctors, and I know you are also a doctor that can also, for those that are near you or aren't willing, are willing to travel to you, or of other people, could you help put together like a list that maybe we can email out to the people that are on the line to provide resources for them?
Absolutely. And like Dr. Dunn said, there, a lot of organizations that do that as well, that keep and have referral lists. I don't know if you're familiar with the White Dress Project. They do that and have that accessible for ladies as well. So that'd be great.
Okay. I'm looking to see if we have other questions. Someone asked, and I don't know if this was answered and I just missed it, is there a minimum number of fibroids that you have to have in order for the procedures that you were mentioning to be performed?
Not a minimal number, sometimes a max number when it comes to minimally invasive procedures. Again, that's why you have to make sure that you're actually a good candidate, because it has to do with a lot: where the fibroids are located, the size of the fibroids, and how they're impacting certain parts of your physiology, and of course your symptoms. So the right procedure for one person may not be right for another. So it totally depends, but it's not necessarily a max or a minimum.
All right. What would you say about for someone that has endometriosis? And I know we also have Sabrina on the line. Sabrina, I know you were also in the house. Sabrina was on our call yesterday. She is a herbalist and more of a natural healer. So I know she also has some tips for people that may not want to have surgery that can help, like yoni steaming and different things like that. So Sabrina, if you're on the line and you have would like to also comment on some of this stuff, please feel free.
Hello, greetings everybody. What's her name? Dr. Hawkins was saying with nutrition, getting rid of a lot of, like I was saying on the other day, getting rid of a lot of processed foods, dairy, meat. A lot of that food is not good for you, especially when it comes to a lot of reproductive challenges. As far as yoni steaming, Yoni steaming with using the herbs, like I said, doing yoni steaming, doing it twice a month, you have to be consistent. So being consistent on a natural healing part, being consistent with yoni steaming, and also your diet plays a major part in your healing process, along with consulting your physicians in regards to other methods.
Okay, thank you so much. I want to make sure, like those of you that if you have other health concerns, if you want to drop those comments in while we have these great people on the line. Like I said, your advocacy starts with you. This is an opportunity, you know, and I wish that, you know, I had these type of opportunities when I was really, really going through. Someone is asking, what is the cost for steaming? You're muted, Sabrina, I think.
Okay. It varies from practitioner to practitioner. It can range anywhere from 65 and up. Every practitioner always has to do a consultation with you because, like I said, everybody's different. Everybody's situation is different. So that's between 65 to 100. I'm sorry.
All right, hopefully you got that. Is there any other questions? Or I think I was asking for people to also drop in different things that you're dealing with health-wise, so that we know. Also that even if it's something that we don't get to address on this call, if we run out of time, that I'll also know and can be able to reach out to you later with a resource or connect you with the proper person. So if there's PCOS, if there's cysts, if there's different things like that, if you can just mention it in the chat, that would be great. Okay. We have, okay, it's a few coming through. All right, we have I'll say quote unquote unexplained infertility. Because I have my own opinion of when people say it's unexplained infertility. But I would like to know what your thoughts are about that, Dr. Hawkins. She's saying after a medical abortion 3 years ago.
So is the question, are they connected? What's the question?
I don't think they have a connection. So that's something that's one of the person that's on the line that they're dealing with. What advice do you have for them if it's being labeled as unexplained infertility after a medical abortion?
Got it. So I agree with you. I don't think that necessarily has a connection. I get that question a lot for individuals who do undergo a therapeutic abortion or a medical abortion, whatever it may be, if that has any bearing on their future fertility. A couple of things depend, like if they actually had a procedure, but you didn't. You had a medical one, so there was no scraping of the endometrium involved, so no adhesions, right? Because that can cause it, but that's an explanation. That unexplained fertility, and put it in the quotation marks, is what we use in medicine when we're just straight up like,
we don't know.
We've ruled out everything else. It's not your tube, it's not your eggs, it's not the sperm, it's not your uterus. You don't have any fibroids or adenomyosis, which is greatly underdiagnosed. We miss that one a lot of times, and the doctor just hasn't figured it out. But we also will put you in that category because we don't want you to lose hope. We don't want you to feel like because nothing in your testing says this is why this is happening, that there's nothing that we can do for you, right? But I wouldn't connect the two. I wouldn't do that to yourself and connect the two and say that and one has anything to do with the other. That's not necessarily true.
And I would encourage that person to, that has been diagnosed with unexplained infertility to keep pressing, keep advocating for yourself. Maybe get another opinion. 2007, when I first tried to get pregnant, when we were first trying, we were diagnosed with unexplained infertility. And, and it was because, as Dr. Sonia, they just couldn't figure out what the problem was. They were like, we don't know. There's no reason why you shouldn't be getting pregnant. You're just not getting pregnant, but we can't figure out what it was. And so by the time I made it to my fourth physician, who actually ended up helping me to get pregnant with my daughter in 2014. But so in 2007, I was diagnosed with unexplained infertility. In 2012, I had my fourth doctor who said, "It's something not right here. I just don't even understand, what's going on and why you can't get pregnant. So we're going to do some exploratory work. I'm going to put you under and look." And what do you know? 2007, 5 years later, the doctor that helped me to get pregnant with my daughter, who is now 5, she was able to tell me what someone did not tell me in 2007. She said, "Stacey, you have one fallopian tube and you have a unicornate uterus." Now, the technician in 2007 did not tell me that. No doctor, nor did a technician tell me that in 2007. But in 2012, 5 years later, over $75,000 later, a doctor that took the time, who, wanted me to be a mommy very, very bad. She did this exploratory procedure, and she was able to come back to me and say, "You have one fallopian tube and a unicornate uterus."
Wow.
That I'm not sure, but they could have been transferring embryos in the wrong place since 2007.
Wow.
And so by 2014, I was pregnant with my daughter. She was able to not only identify that issue, but to say, "Hey, I'm going to have to get some different types of instruments in order to transfer these embryos into you next time we do it," all of that. But I did ultimately get pregnant with my daughter because I had a doctor who was willing to, to ask some questions and to say, "Hey, something is not right here." And so I say to you, my sister, who has been diagnosed with unexplained fertility, don't accept it. Keep pushing. Keep advocating for yourself. Don't lose hope, because you will find a doctor that will be able to help you to give you an explanation for what doctors have diagnosed you with unexplained infertility.
To that point, I am a big believer in second opinions. Even if a patient leaves my office and she feels like her questions haven't been answered, second opinions are, there's nothing wrong with that. Because I agree, Dr. Dunn, it's been many a times when I'm like, ooh, I'm looking through the records like, ooh, when did this start? Why ain't nobody told you this? And that goes from endometriosis and just simply taking a look. Like I said, adenomyosis is one that is greatly underdiagnosed and is actually associated with recurrent miscarriages. And people, if you don't know, you don't know. And there are some doctors that simply do not know, because that's either not their area of expertise, or they're not taking the time to do that other evaluation and investigation and being that detective. So 100% agree with that one.
Yeah, I think also like listening to your body, because for me, like it took me to experience a greater deal of pain, because as I said, I was already dealing with pain, but it took me to have a cyst rupture, at home, for me to realize that I needed to. I always say pain causes you to move. Like if you're not moving for anything else, for me at the time, I thought the more pain I was in, the closer I was to having my child. In some twisted sort of way in my head, I thought this was what I had to carry. My pain is what I had to carry. So I thought the more pain I had, I definitely got to be pregnant this month because this pain is unbearable, but it took that to happen for me to actually advocate for myself. So with what everybody is saying on this line today, I think it takes a certain kind of doctor that has your best interest at heart. And unfortunately, not every doctor will. And it takes you to really form that connection and find that one that will see you more than a number and will look at your chart and will reveal some things to you that may be considered unexplained, but maybe that someone else can explain.
Deanna, may I ask you, how old were you when you finally had that aha moment and that you listened?
I was in my 30s.
So if you were in your 30s and you said at 11, somebody had already told you to start hushing it up, to push it down. So almost it took you 20 something years to resurrect that voice, right? And so for many of us, that's what we're taught to do, especially as little girls, to not give voice to it, not pay attention to it, right? To push it down. And so you really had to go through it took you 20 years to relearn that, to say, hey, I got to listen to my body. And so I think that for all of us, that becomes very, very important, that we have to learn how to listen to our bodies and listen to that voice that we have pushed down and told to hush, and to realize that it is so significant, even as it pertains to our own reproductive health. And so, really to give voice to it. I mean, I do that with my daughter. My daughter since she was 2 and 3 years old, she's been able to tell me and communicate to me about an earache. I don't say, baby, you don't know what you're talking about. She's told me my ear is hurting, mommy. I take her to the doctor, and the doctor, like, the baby has an earache. And so us really getting to the point that we really empower ourselves to listen to ourselves and to recognize that our body speaks, and allow it to give voice to itself.
Yes, and also for it to have a voice. Like, I think so many times our pain isn't heard. It's not seen. I know of someone that, had a near-death experience in the ER because her pain wasn't seen. She has endometriosis and was bleeding internally. Yeah. And the doctors were taking, we're in Philly, so they're taking gunshot victims and, over her. When they finally bring her back, they realize she's dying.
That's right.
So it's people like that it's like a wake-up call, and it causes me to fight harder, because that's not okay. It's not okay for our pain to not be seen. Like, I was always told that I overreact. So all this, for the longest, I was quiet because I thought that this might not be really bad pain. Maybe I'm over exaggerating. But I started to realize that no, this pain is not normal. It's not normal for me to be balled up and not be able to go outside and not be able to do things. So I wholeheartedly agree with you, which is why, yes, I found my voice. And this is why I fight and I use my voice for people that haven't found theirs yet. I will gladly speak for people that haven't found their voice yet and help connect them. It's very, very important to me. We have some other questions in here. Sabrina, will you ship your herbs?
Yes. After I do a consultation with them to meet their needs, yes.
Hello?
Did you hear me?
No, it froze. The whole thing froze.
Oh, I'm sorry. I was saying, yes, I do. After I do a consultation over the phone to meet their needs, yes, I do.
Okay, awesome. All right. Let's see. We have someone dealing with PCOS, multiple heavy periods a month, no ovulation. Any advice for someone that's dealing with that?
So PCOS is an endocrine abnormality, really much more hormonal than anything else. And with PCOS patients, your doctor you never really want to hear from your doctor certain things like eat right, lose weight, exercise, get right with your life and the Lord. But PCOS is one of those things that actually does make a difference. There is the PCOS, the S in PCOS is syndrome. So it's actually a syndrome that has a metabolic component, and where those patients are more prone to high blood pressure, diabetes, truncal obesity, and things like that. So actually changing your diet, losing weight, increasing your exercise actually can help your ovulation. It can help you more naturally ovulate. And if you've already gotten all of that in order and you're still having difficulties, in the way that you would know, honestly, is just by naturally what your body will do. You'll start to menstruate more regularly. And you can sync that up with ovulation a good bit of the times. If you're not able to do it after kind of adjusting for all of that, then you want to talk to your physician and find out if there's anything else. And that also depends on where you are in their journey. Are you looking to just regulate your cycle and have them more regularly and predictably? Are you looking to decrease the amount of cysts that you're making? Are they rupturing and causing you pain? Or are you looking for fertility? Because the track to what we would do from a medical perspective is going to be different depending on what your end goals are. But the start, the root, is to just get metabolically healthy.
While you're on the line, Dr. Hawkins, I'm getting the question, will you offer virtual second opinions? Do you do that?
Yes, I do actually. If you go to getfibroidhelp.com, you can just send me a consult request and I'll email you personally with information to do so. But I do, just like this. We'll just look at each other and chat.
Okay. You say Get Fibroid Help, right? I just put it in the chat for those of you that, oh, you did too. Okay. All right. So what are your thoughts on using birth control to shrink fibroids or to, I personally despise birth control, but that was also something that I was told that would help with my undiagnosed endometriosis. I was told to go on birth control. That's what I did for most of my 20s. But I realized that it caused me other pain. It caused me bad headaches and other issues. So I stopped it. But what are your thoughts on it?
So yeah, birth control. Okay, so let me preface this by saying birth control is not necessarily the devil, but it also is not usually the answer, because a lot of the imbalances that we have in our system that contribute to endometriosis, fibroids, everything is hormonal. And with birth control, it's synthetically kind of taking over that balance that your body naturally has. Now, granted, because you have higher estrogen levels, we're women, naturally our ovaries make estrogen, that contributes to fibroids and fibroid growth. So estrogen and birth controls aren't going to shrink fibroids any day of the year. And there's a lot of controversy on, is it estrogen dependent or progesterone dependent? And those are the two components of most birth controls. So in my opinion, I try to have patients avoid those hormones in their system while they're dealing with their fibroids until we can truly take care of the fibroids. Now, once we take and eliminate all the fibroids and get everything done and over with in that regards, if you truly need it for birth control because condoms can't be trusted, then that's a whole different story. But when you're trying to regulate your system to get rid of fibroids, usually adding those hormones aren't necessarily helping the situation. Now, some people will do it for different reasons. I need to get better control of my bleeding. Like I'm hemorrhaging every month and I'm anemic and my iron levels are low and I just don't feel well. That might be a reason to do it temporarily, but it's not the end all. It's usually not the solution, and birth control ain't shrinking fibroids any day of the year.
What would you say to someone that's dealing with the fibroid inside of their uterus? Is it true that they will not be able to carry or become pregnant if the fibroid is inside the uterus?
So it's never true, that whole, never, I never say never as a doctor, because I've seen ultrasound pictures where that baby and that fibroid are straight chilling together and grow happily ever after until full-term beautiful pregnancy. So I never say never. Usually fibroids that are inside of the cavity, they impact that a bit more though when it comes to fertility, both getting pregnant and staying pregnant and carrying a healthy baby to term. And even if you're able to do so, it can impact delivery. Can you deliver vaginally very healthy, or will you have a lot of blood loss or hemorrhage during C-section? So it's a lot that goes into that. It's very, very hard to predict though and say someone can't get pregnant because they have that type of fibroid. It really depends, but many, many women get pregnant with fibroids. Like you stated earlier, the statistics show that 80% of women will have fibroids at some point in their reproductive years. And you know, a lot of those patients don't even know they have them. Some of those patients don't find out they have it until they do their first pregnancy ultrasound.
Also, as some encouragement to those of you that are dealing with fibroids inside the cavity, or just dealing with up against some odd numbers, as I shared with yesterday, like I was told I had less than 1% chance. Like I didn't even get a 1%. Had a less than 1% chance of conceiving after my surgery with my one little raggedy tube that I had left. Obviously that was definitely against all odds. Like nobody can understand, or when they look at me on paper, how in the world my daughter is here, but God. And also my aunt, who has a son who is now in his 30s, back then, when she was trying to conceive, she was actually told to have a hysterectomy, and she refused. She has dealt with fibroids, and she's actually just now getting to the point that she was thinking about having it removed because it's starting to cause other problems. But she didn't want to have it removed. They wanted her to have a hysterectomy. If she would have listened, she would not have had my cousin. And the whole time she was pregnant, that she got pregnant, which they couldn't understand how she got pregnant with the fibroids. Her doctor told her every time she went to the office, I don't know, you know, the baby's not going to make it. I don't know why you're even trying to do this. Every single time she went in, up until she delivered. So a healthy baby boy. So, you know, just want to give you encouragement that, you know, God has his own numbers. God has his own statistics and his own odds. You know, a lot of times, you know, doctors have to give it what it looks like on paper, but we have to also just pray and have faith that God, he doesn't, you know, all he needed was my little raggedy tube to work with, you know. I'm sure with my aunt, her uterus, it wasn't ideal. Like the fibroid was huge. And I can't remember what the size was, but it was very large. So it was, I think she explained it pretty much like she was carrying 2 babies, you know, essentially. But the baby survived and the baby was healthy. So, you know, I like what you said, Dr. Hawkins, that, you know, never say never, you know, never say never. And I know we are starting to go over. I want to make sure there's a couple more questions, if you don't mind answering a couple questions before we go. We have an increasing number of women in their early 30s reaching out to us saying they are being told they have a low egg reserve or require a surrogate. Do you have advice for anybody that's on the line that has a low egg reserve?
That's interesting. And in their early 30s. Very interesting. So when we look at fertility, just like global view, fertility is complex. So sometimes I have patients that come to me and they're like, oh, I have endometriosis, I can't get pregnant, or I have fibroids, I can't get pregnant. And I tell them it really sometimes is not necessarily dependent on one category. And the same thing goes for ovarian reserve. Ovarian reserve is a number that we do with lab testing to look at your follicle stimulating hormone and anti-Müllerian hormones to kind of give us the age of your eggs and the answer to the question if you're making enough hormones to produce good eggs. That number, again, to piggyback off the last discussion we had, is not finite. It's not a never or impossible number, because there have been many that can give the testimony that they were told the same thing and had poor egg reserve, but were able to get pregnant even spontaneously. My best friend was like that. The thing that you do want to do, though, is speak with your doctor, because you have options. So if you do have a low egg reserve, there are things and medications out there, Clomid, different ones, that can be given to actually boost your production, right? That can actually be given to augment and actually help you make and produce more eggs. And then, of course, there's different steps along the way too. There's IUI, there's IVF. A low egg reserve doesn't count you out.
What would you say with fibroids, are they more likely to grow back in the same area when they grow back, or does it change?
So not necessarily the same area. I think that's one question that we don't necessarily know. So again, statistics kind of say that if you have an intervention for your fibroid, may it be UAE, a myomectomy, anything short of a hysterectomy, if you're leaving your uterus, and of course you have ovaries that are functioning and releasing hormones, there's about a 40% chance that your fibroids can grow back, and not just grow back, but grow back to the extent that they can cause issues and problems and you need another intervention. Where they grow, how they grow, is the likelihood of you having regrowth of your fibroids higher if you have multiple fibroids removed versus if you have just one big 10 centimeter fibroid? You know, what if you are a vegan, or what if the answers to those questions are not known. There's still a lot of research being done. The NIH has great research studies right now trying to look at and understand the complexity of fibroids, but fibroids are complex. How and why and where they regrow, who knows? I mean, I had my fibroids removed 10 years ago and I'm in the 60%. They never regrew. Never. And I do my own ultrasound every year. I'm a woman of faith, but I still be like, I need to see, I need to know. Are they back? And they have not regrown. So I'm a part of that 60%. They don't always regrow, and they certainly don't always complex. How and why and where they regrow, who knows? I mean, I had my fibroids removed 10 years ago, and I'm in the 60%.
I think she's playing the Facebook replay was playing in the background. All right, this is the last question, and then we will wrap up. What are your thoughts on Orilissa? I don't know if I'm saying that right.
Sure. So Orilissa is a medication, and it's actually the newest medication out for endometriosis specifically.
Okay.
If anybody's ever heard of Lupron, it was initially dubbed the oral Lupron. It's not, and I can say that only because I know medically what it's all about. It's not the same exact thing as Lupron, but it works similarly in that it decreases your estrogen levels. And because endometriosis is an estrogen-dependent disease, and the inflammation and therefore the pain comes from that estrogen, when you lower the levels with medication, that's how a lot of women will get pain relief. Right. So it's an option that is out there for endometriosis management that's non-surgical. So it's more, therapeutic and medication. I am a believer in giving my patients every option. So I talk to them about the pros and cons of every option, meaning birth control, Lupron, Orilissa, surgery to resect everything from the rooter to the tutor. We're going to talk about all of those and make it very specific to you so that we can work together to make that decision. So, it's in my armamentarium of options for patients.
Awesome. Thank you. Thank you so much. It's so interesting because for someone like me that has dealt with endometriosis for most of my life, but like I said, I didn't know. I just got like, you probably, but no one would ever diagnose me. They didn't know until they cut me open to remove other things. And they're like, oh yeah, we do. So let's go ahead and scrape some of this stuff away. But, why did it take till I was like 30, almost in my mid 30s for that to happen? So with that, I want to wrap up because it is 7:30. But I know that Dr. Stacey Edwards-Dunn, I know you have your Fertility for Color Girls group, and you have your most recent Motivation Fertility Mondays, where you're focusing on PCOS and low insufficient egg reserve with Dr. Frew. So is there anything that you want to say about that for anybody that's on the line that wants to join in with that?
Well, we already had that. I was just saying that if they wanted to access more information to what Dr. Hawkins stated, they can go to the Fertility for Color Girls website to view all of our, different discussions that we've had. But the most recent one that we had in March was around PCOS and low ovarian reserve. So just check that out. And then Fertility for Color Girls, for any woman that is on the line, we currently have 13 locations. And those 13 locations, due to the shelter-in-place mandate, they're all meeting virtually. So if you would like to meet with our groups, we would love to have you. And then also, finally, for those who are not aware of the Hold On to Hope book, I would like to encourage you to get a copy of Hold On to Hope: Stories of Black Women's Faith, Fertility, Faith, and Fight to Become Mothers. I think that it will bless you. And it speaks to all of this that we are, that we're talking about. 28 women who have struggled with different types of infertility tell their stories. And then we have doctors that share, pastors that share. So it's some great information in the book. And again, I think that it would be helpful for those. And if you're interested, I'll post it in the message here if you want to receive it. But please, all of our services are free. We also have grants that we offer each year. We give about $75,000 in both grants and medications. And so, we want you to know that we're a resource to you. We can connect you with doctors and all types of other health, health providers from all over the country. And so if you are in need of those, please feel free to contact. And for those who are in the Philly area, we have a Philly chapter. And so please come out or make sure you contact us if you want information about those chapters. And again, I'm honored to have been a part of this discussion. And it's nice to meet everyone.
Thank you so much. And I did get to meet you when you came here for starting the Philadelphia chapter. I did come out, and that's when we got connected. So I thank you so much for agreeing to be a part of this and for joining us and your willingness to provide resources to the people that are on the line. And thanks again, Dr. Hawkins, for your participation. And literally, guys, it was last minute. Last night, I found her and I was like, oh my gosh. And I was saying to my husband, like, she doesn't know me. She's not going to respond. But I know that was nothing but God. So thank you so much. Because I on my heart, I kept thinking, I need a doctor on this call. I need a doctor on this line because I wanted you guys to also have that professional resource that can answer some of the questions that I knew that you guys had. So thank you again, guys, for joining in. This was our second day as it comes to a close. I will send I'll get with both Dr. Dunn and Dr. Hawkins to see about like a referral list, see if I can get you some of those resources that were mentioned on the line. Rochelle, did you have your hand up just now? Okay. All right. Well, thank you guys. Have a wonderful, wonderful evening. We will be having our next one tomorrow, day 3. And day 3 is called the Fertility Trinity. And that is with Carolyn Grace Ashurst. And that's going to be at 6:30 Eastern Standard Time tomorrow evening. So if you haven't registered, please do so. We'll be continuing this conversation of healing and things that we can do right here and right now to advocate for ourselves. All right. Thanks so much.